Hey everybody, Ryan DeWitt here from DeWitt Physical Therapy. Today I wanted to talk about knee pain and give you a couple of quick and simple interventions that you can do to help get rid of it. If you're an athlete or you are an active person, chances are you either have had knee pain or you got a little knee thing that kind of flares up from time to time. Super common, it's almost ubiquitous in the athletic community. As a result, it can be troublesome just sometimes to figure out exactly what is going on. You know, the knee joint is supposed to be a hinge. There is some rotation that happens, but for the most part, it's designed to work as a hinge joint. However, it's a hinge that's really caught between two other joints that tend not to work super well, which are our ankle and our hip. And if we have problems at either of those two ends, or a lot of times both, sometimes that knee can kind of get caught in the middle. That being said, aside from looking at someone's basic mechanics and trying to make sure that they're squatting appropriately, lunging appropriately, going up and down stairs, and all these little things that we can do during the day that can kind of be a negative for it unless we're doing it correctly, sometimes some of the tissue is just tight from either too much activity, not enough activity, bad movement patterns over time, and a lot of this stuff can be easily addressed. So what I want to do is I want to show you a couple of my favorite tricks and tips with just a lacrosse ball. Right now especially, I think simple is better. Let's start with some really low-hanging fruit and then kind of see where it goes. So let me show you what I'd like you to try to do, and then let's do a few things and then see how it feels. So if you have any knee pain, let's do something that would maybe test it out. If that's a squat, if that's a go and check out, go up and down your stairs, do something that you feel like would kind of test it and just kind of make sure that's a reliable test. Then if we take this lacrosse ball, and I really like a lacrosse ball much more so than like a tennis ball, a mobility ball or something like that anything that's used to kind of mobilize tissue that has a little bit of a tackier surface to it, it's going to be really good. So the lacrosse ball is nice because it's hard, but it's also nice because it's rubbery, and so it gets a really nice purchase on the superficial layers of the skin and all the tissue here. Sometimes things get sticky or stiff, and that doesn't mean short. That just means that it's actually not gliding past the different layers that are below it. So a lot of times we want to think about increasing the ability of the tissues to slide past each other or restore these sliding surfaces of those multiple layers of tissue. Lacrosse ball can be really, really good for that. So let's kind of take some basic anatomy here. And so if we have our foot, and I want to think about my foot being here, here's my ankle, here is my knee, and here's my hip, just clarity. But I also have my knee capped. So we have our quads come down here, we have our IT band that kind of comes down to the side, and the retinaculum attaches here. We've got our hamstrings down the back side, we got our calf down here, got some muscles in here, we got some like our plantar fascia down in the bottom of the foot. Now, if I am doing something where my knee is going inside of my foot, and I do this for a long time, mechanically we're putting some additional strain on different parts of the joint. We're also winding up some of this lateral tissue that's going to pull the kneecap this way. And this tissue can be really tight, but also as this kneecap can kind of get shoved into one of the parts of the groove over here in the distal part of your femur, and it can kind of rub. So these are some of the mechanical things that can end up giving you some knee pain. But sometimes if we just fix it here and then we step up and down and it's like, hey, knee pain goes away. It's like, great, that was a very simple mechanical fix. But what if I've been doing some of these things for too long? Or what if I sit too much and this IT band and this quad tendon are a little tight, and maybe I'm getting some more specific compression. Maybe my foot ends up being kind of rotated out, my knee decides to dive in, then this hinge joint ends up working with a little bit of external rotation here. Well, let's address that part. So the basic mechanical thing is keep your knee over, if not slightly outside of your foot and ankle at all times when you're doing squats and lunges and steps and whatnot. But even if you're there and something still kind of feels tight, let's just see if we can loosen some stuff up around it, get those sliding surfaces to slide a little bit better. So we're going to take this lacrosse ball, and I'm going to come in here real close so you can see this a little bit better. And if I take this, and if I kind of hopefully you guys can see this, but I'm going to kind of grab it, and if I even pull, see if I pull down here, you can kind of see the tissue moving all the way down here. It's because I'm getting that superficial tissue to glide, or I'm tacking it, and then I'm getting the general tissue to glide. So what we'd want to do is, can we put that knee into some amount of flexion? And then here's my kneecap. I got my patellar tendon, I got that retinaculum, I got this kind of suprapatellar region, even got some joint line stuff here. But I can take this ball and just kind of press it in and rotate it. And what's going to feel like, it's almost like a little skin burn. So I don't want you to like rub it up and back and forth. That's not going to feel very good. But can I get it and just twist it, which is going to pull that tissue. And I can go all around the knee. And can you see how I'm doing that? And maybe some of that's pulling some of that tissue. Yeah, I'm pulling here, and you can actually see it on the camera all the way down here. So that's what I want to see. Can I do this? Can I move around that tendon? Even if I just tack, I can go up and down. I can go side to side. I can rotate it. You know, it doesn't really matter. I don't really care. I just want this stuff moving. So what I'd do is I'd spend maybe 1 to 2 minutes just going all around the knee. We can go below the knee, again, patellar tendon, a little bit on that joint line if it's not too uncomfortable, along here, even kind of in this like lateral IT band area. The next thing that we're going to do, though, that I want you to try, is we're going to take this lacrosse ball, and we're going to take it and we're going to put it behind our knee, but slightly to the outside. So this is going to do 2 things. One, it's not super comfortable, but I'm going to, as I kind of capture it there and I start to pull, there's this outside lower leg bone here called the fibula, and this is called your fibular head. This joint floats, and it's the same thing it's the opposite end of what is down here on your lateral ankle. And so if this isn't moving, it can certainly affect your knee. It can also affect your ankle mobility, which, like I said before, the knee is trapped in between the ankle and the hip. So sometimes working up here helps that. But also if we work here, like I said, that foot sometimes wants to get turned out, and that kind of drives that knee in. So if I actually place this on the kind of the posterior lateral, so kind of like the back and outside of that right knee here, and I pull, it's taking this fibular head and moving it. It's moving some of the tissue back here. But also as I pull in, it's almost rotating this lower leg in instead of out. And the in is actually really important because that's some place that most of us don't go very well. So in PT, that tibial internal rotation, we work on this a lot. But this is a great way to do this at home. So I'm here, I'm pulling it in. It's a little uncomfortable back here, but again, it's driving this lower leg into a little bit of internal rotation. And I'll show you why that's super important in a second. But again, it's also moving this, and it's a little uncomfortable back here, but that's okay. You're in control as far as how much you do. You can also take that foot and kind of turn it in a little bit and then pull in and see how it feels as well. Might feel better, might feel worse, but none of this should be painful. It should feel therapeutically uncomfortable, perhaps. Okay. Next, let's go ahead and retest. But before I do, let's explain that rotation a little bit. As my foot is turned out and my knee wants to dive in, this lower leg is actually rotating this way. If I have my knee directly over my foot and it's here, then this thing is actually rotated in as this is rotating out. If I go a little further even and my knee swings out, this tibia wants to rotate in. That keeps all the things that are like that knee joint essentially aligned a little bit better on both the inside and the outside. So that rotation, that again, it's supposed to be a hinge. I did say there was a little rotation. That rotation is actually really important for aligning the knee joint itself, but that also helps align that kneecap. So I want you guys to now retest that squat, that lunge, that step, or whatever movement that it was. But I really want you to be mindful of that knee being directly over, if not slightly outside of the foot. For our cueing and our purposes, what will guide our athletes and our patients into doing is if we were going to squat, can I have you keep your feet about shoulder width apart? You can turn those toes slightly out. I'm going to think about screwing my feet into the ground, which just means really like pushing my knees out a little bit, and my arches should automatically lift. My glutes will turn on. And all I'm going to do is sit back into my heels. My knees are not going to go inside. They're going to stay at my foot, if not slightly outside. I'm a little bit bow-legged, so the outside or slightly outside feels better. I'm going to drive through my heels and stand back up. So hopefully with this, we can address, with just a simple lacrosse ball, we can address some of the basic sliding surfaces right around the knee, even some of the joint mechanics right around the knee that might even affect the ankle. And then with just a simple awareness of where my knee is in space as I squat or lunge or go up and down steps, what I'm doing mechanically to things, to my knee, and even some really simple cues as far as like, well, what do I do or what should I be thinking about when I squat? screw my feet into the ground, activate my glutes and my arches. My knees will kind of push at least over my feet, if not slightly outside. And especially as I stand back up, I'm going to press through my heels and squeeze my butt. Now we have a very comprehensive approach, and even though I just threw a lot at you, it's actually very simple concepts and a very, very simple tool. So give that a try. See how it feels. Lacrosse ball you can usually get for around $5, so it's a very easy thing to find. Those are some very simple interventions, and they can make a huge difference if we put it into a program that offers some awareness to where that knee is in space. So if you would like us to dive deeper into what is actually causing your knee pain and to give you a comprehensive approach and how to address it, like I said, a lot of times it can be some problem in the hip, it can be a problem in the ankle, it can be affecting the knee. There's a whole system that we need to look at that's behind this. That is what our team is here for. So go ahead, you can reach out to us. We can offer telehealth appointments, so we can do this via Zoom. We can do this in person. Let's create a plan for you to get you out of this knee pain and make sure you can get back to doing every single thing you want to do. Give it a try, and we'll talk to you soon.